So let's go ahead and dig in a little bit more into PTSD, specifically in those in the military. And I think that this is so important because for myself, I see a lot of folks that have been in the military, they're retired or they're still in, and they definitely have seen some really challenging things. And they are needing support, right? Many times it could be war, but it could also be exposure to things that they can't talk about, right? It could also be just things that have happened during their service, even being isolated. That's a big thing. It's really hard for a lot of military also because their families are left behind, and that really changes the relationship. And so when they come back and try to integrate, it's quite challenging. Um, there's a lot of things that happen when they're abroad and when they've been deployed. And especially a lot of our folks that are, in the FBI, CIA, also the SEALs, they've seen a lot of things and things that they can't talk about. And it is crippling for them. And so we need to really look at the research of how we bring these folks back into a really beautiful healing process that's really authentic for them, but also recognizing that I've seen healing that has really transpired in a moment and after decades of suffering. And so I just want to share a little bit with you guys about that. So my husband is actually a retired Marine. And so we have some insight into this, but because of where I live, I see a lot of folks, as I said, within the military from many different branches, anything from Navy, Coast Guard, all kinds of folks who have served. And we are so grateful for the work that they've done, but we also need to do a lot more for our military and helping them come back to a place of wholeness. So let's look at that a little bit in the research. I want folks who have ties to those in the military or those who are in the military to really understand their bodies and to also be the healers in their own path, right? You can be a co-creator in your own healing. People just don't teach you how to do that. So I want to give you some tools and tips. But let's talk about the research first. So after trauma occurs, specifically one that would be deemed to cause PTSD, and many people, they may not even have the diagnosis of PTSD, but it's assumed. Even some of our military that served in the 70s, they might not have had the actual diagnosis and maybe they got out, but we definitely know that they've been suffering, and I see that as well. And so when that unresolved trauma is sort of living in that person still, right? It could be with some of the side effects or symptoms that we see with PTSD. It could also be that their family recognizes that they are being more reclusive. They're not enjoying the things that they used to do. We want to try to help them as much as possible and also bring insight into what's happening in the body. So after one of those significant events that we would term as a PTSD, is that what happens in the body is, as I shared earlier, we have all these different chemicals in our body. We have neurotransmitters, which are our brain chemicals. We have also hormones in our body, which send other types of signals, right? Stranger danger, fight or flight, let's go, right? And so if you think about the ultimate surviving, that's our military many times. And so they are so programmed, right? They know how to do it very quickly. They can, they have to be on their feet in a moment's notice, fully dressed, right? So they know how to be ready for survival. And so what happens is, for an example, is the immune system can really take a hit. So when the body recognizes that it's in this fight and flight, we talked about cortisol earlier, that serves as one of the main chemicals in our body that sends that fight and flight response. It changes our immune system. So our adrenals secrete cortisol. And cortisol is what allows us to have energy and to fight the bear or to be in the military, right? When there's something very scary or something that needs to be taken care of. And so what happens is over time, over and over and over again, we may see that cortisol goes up for that individual, and they're very, let's say they're on edge, they're very stressed, those kinds of things. And it's like you can say something and they're very reactionary. So we can see with PTSD, there's more reactions that happen. It makes sense because they think that the body thinks it's running from a bear and or it's life and death. And so what happens is then this chemical of cortisol from the adrenals again secretes that. We have to think about the adrenals also govern our immune system. And so for a lot of our military, we know that in their service that they're at a higher risk for certain types of illnesses. It could be allergies because of things that they've been exposed to environmentally. We could think about Desert Storm. We could also think about not just allergies, but we could also see a lot of skin stuff like eczema, psoriasis. We can see where the immune system doesn't know if it's something's dangerous. Again, the body's reacting. It thinks there's stranger danger. So you can see more allergic reactions. But you could also see the body turning on itself in a case of something like autoimmune disease, where all of a sudden it doesn't know what to attack. And so it starts attacking itself. So that's a second thing that we can see in our military with PTSD. Now, again, this can also apply to other folks that have PTSD, and we can, definitely talk about that at another time. But the third thing that we also see is that they have a harder time with fighting infections. So their adult cells of their immune system, the T cells, have a harder time engaging with a virus or bacteria appropriately because, again, the body thinks it's in this ongoing state. Well, after a while, the body's like, I am tapped out. I can't keep this cortisol the way that it is, and it will flatline. And flatline's not great. It's not really great to have it super high, and it's not great to have it super low, but the body will just sort of bottom out because it cannot handle it anymore. And that is the cortisol pattern that we see a lot with folks that have PTSD that's been there for some time. The body just can't compensate anymore. And so the immune system is also not engaging appropriately. So again, infections may be more of an issue. We may also see that their B cells, which were sort of their innate immune system, think of their B cells or that help with our immune system. Those are like, think about our immune system as we get with babies. As a baby, we have B cells. And so the baby B cells and then the T cells as an adult have a harder time engaging with infection. And what that also means is down the road is that there could be something dangerous that the body is not engaging with, not just an acute infection, maybe in a chronic infection, even things that we saw like COVID, but even cancer. And so this is one of the things that through the VA that they will look at and see if there is any type of cancer. And I will say that I see this quite a bit, unfortunately, with trauma that has not been resolved. And so it's really important to engage any of our military, if they have experienced PTSD, to really work on their immune systems. And it's not just about taking a pill. It's not just about getting, taking the most, big supplement that's out there or that kind of thing. It's really about toning the autonomic nervous system again, right? And helping with that fight and flight response. And so there's so many ways to do that, and we will talk about that in subsequent videos. But I just really will share just a few right now, just pausing, but sometimes that can be very hard if the mind is still going. So things like heart rate variability training and support, breath work can help. Movement is very helpful for people. But the only thing is we want to be really mindful about this. If someone's in fight and flight, we don't want them doing a ton of cardio. That's going to also wear and tear on the body. We want them to have more relaxing types of exercise that can help tone the autonomic nervous system. But things even like singing, you can put on your favorite song, right? And also you may have heard of like tapping or EFT. That can be really helpful. And one of the most valuable therapies that I have seen is EMDR. But anyway, I just wanted to share a few things with you guys about how trauma, specifically PTSD, affects our immune system, especially for our military, and that we don't want to carry that on. We don't want to pass that on to our lineage, and how we can actually keep that from happening is tending to ourselves in this moment, clearing these old patterns of disease so that we do have a brighter future and that we also can heal our lineage.